Hello and welcome to everybody to our February Wellbeing webinar series. My name is Sarah Michaels and I'm Vice President of Kinetiq Health right here at Apex Benefits. We are so excited for you guys to join us this month for February's Heart Health Month. The theme of today is the pulse on better heart health, and I am joined by two guests. I am going to turn it over to Jordyn to give an introduction.
Yes, hi, I'm Jordyn Schwerin, and I am a registered nurse at Apex Benefits.
Hi, everyone. I'm Haley Rudolph. I'm a Senior Development Director for the American Heart Association. Happy to be here.
Thanks, guys. And as you can see from my background, we are so excited at Apex to be celebrating Heart Health Month for the full month of February. And today we have brought Haley Rudolph from American Heart Association as a special guest presenter because no one does it better than their team. And we are so excited for them to talk to us about what it means to be heart healthy. How can we live good, sustainable lives? And Jordyn and I, as the nurses at Apex Benefits, are always here to help your organizations collaborate on better health. So let's turn it over to you, Haley.
Thank you. First, would love to just share a couple of photos. I don't know, Jordyn, Sarah, if you want to talk about this. I'm guessing was on Wear Red Day. Thanks for celebrating with us.
It absolutely was. And here's some of our employees at Apex Benefits. I know a lot of our clients also got to take part in that. So Wear Red is something that you're going to hear Haley talk about, but it's something we absolutely encourage all people to take part in.
Thanks, Sarah. All right, well, would love to jump along. Sorry, my mouse is a little crazy, but welcome everyone. Thank you for including the American Heart Association in today's webinar. Very excited to be here today. February is a big month for our organization. You know, with it being American Heart Month, we hope that our message is being cast far and wide. So it's a privilege to be here with all of you today. I hope most of you know, but if you don't, the mission of our organization is to be a relentless force for a world of longer, healthier lives. And very exciting, our organization is about to turn 100 in year 2024, which is a huge milestone for not just us, but the people that we've been serving along the way. And so a lot of the work that we are doing leading up to our centennial birthday is all around our 2024 impact goal, which is a goal we set for where we see our organization by the time we turn 100. And so wanted to share a little bit of what that looks like. Our goal is that every person deserves the opportunity for a full, healthy life. And as champions for health equity, by year 2024, the American Heart Association will advance cardiovascular health for all, which includes identifying and removing barriers to healthcare access and quality. No small feat, but we've got the tools to do it and the people and resources to help support. At the foundation of our organization has always been rooted in science and research, access to care, advocacy, emergency cardiovascular care. These are things that we have been doing since our inception. But as we look to driving equitable health impact, we're looking at 5 areas of our work and really honing in on those. And so would love to just share for a moment what each of those areas of our work are. So women's health is a huge pillar of our work, looking at reducing the risk in women, looking at maternal health. We'll talk a little bit more about that, but that's a huge area of our work. COVID, as everyone knows, has impacted all of us for nearly 2 years, and the impact that it has had on cardiovascular health is no small impact, and we know there could be long-term implications. So our organization is very much in this space when it comes to research in response to COVID and supporting our communities in need. Then we look at tobacco and vaping and the elimination of both. This is something that we were pretty darn good at, you know, up until a few years ago. I feel like we were eliminating tobacco. We were kind of kicking the stigma around it. But when vaping became into the picture, it became a big concern again, especially with youth. And so this is a huge space that we are in when it comes to education and advocacy, and making sure that we're showing the harmful effects of both nicotine use and those vaping and e-cigarette devices. And then looking at patients and really looking at how we can help control their chronic conditions, such as high blood pressure. And so looking at that, knowing it's, one of the leading indicators of most diseases is hypertension, but especially heart disease. And how can we empower patients to know their numbers and to control their blood pressure? And then healthy living, which some of us kind of call our catch-all pillar, really includes 2 areas of our important work, and that is improving nutrition security. So not only making sure that everyone has access to food, but so that everyone has access to healthy food, which is a big difference. And then lastly, but certainly not least, building mental well-being. I think all of us have felt the toll of the pandemic, no matter what kind of seat or role you sit in. And we are big believers that our mental health has direct impact on our heart health. So a lot of our work shines through our mental well-being focus too. I know that's a lot of information, but just think it's really important to understand the lens through which our organization is looking at all of our work, and it's through an equitable lens. But would love to dive in a little bit more specifically about heart disease and stroke by the numbers, and how we can all live a heart healthy life. And so I always start by just still sharing that unfortunately, heart disease is still the #1 cause of death for both men and women, believe it or not. And despite all of the losses and deaths that we've had with COVID, heart disease still remains #1. And that's why our organization is here. That's why we're sharing our message. That's why we continue to have a lot of work to do. So a couple of quick facts. Almost 127 million US adults have some form of cardiovascular disease, and 18.6 million people die every year worldwide from cardiovascular disease. The other side of that is it's a health equity issue. So approximately 60% of Black men and women have some form of cardiovascular disease, and then more than half of Hispanic men and 43% of Hispanic women, they have some form of cardiovascular disease. And then moving on a little bit about stroke, which our organization covers. Stroke is the #5 cause of death, and it's also the #1 cause of disability in our country. And so really looking at, stroke, it's the interruption of blood flow to the brain. Without oxygen-rich blood, our brain cells die. And time is of the essence with stroke. And so a lot of what you'll see coming from our organization is how can we empower people to know the signs of a stroke, to act quickly, because getting someone the care they need when they're having a stroke is crucial to what the rest of their life, their survival, their prognosis will look like after suffering one. So we always say, please remember the acronym FAST, which means face drooping, arm weakness, speech difficulty. It's time to call 911. All right. So when we look at, overall health, but especially ideal cardiovascular health, what does that mean? Well, we're looking at absence of disease, favorable levels of health factors, favorable health behaviors, someone who maybe has never smoked before, or maybe someone who actually just quit smoking a year ago. Looking at someone's BMI, looking at how much physical activity they're getting, knowing their numbers around cholesterol or blood pressure, fasting blood glucose, all of these things impact, ideal cardiovascular health. And so I'm going to get into ways that we can know these for ourselves and help monitor them and make a difference with some quick, simple few changes. But before getting to that, another important factor is knowing your own risk. A lot of cardiovascular disease is genetic. And so the importance of knowing your family history is crucial, because you may be more predisposed to forms of cardiovascular disease than others, simply because your mom or your father may have had them. Also knowing your age and your sex may be making you more predisposed to certain risk factors. Again, going back to knowing your numbers, there's a theme here. So if you're someone who historically has had high blood pressure, that's a risk factor, and that's something you should be aware of when talking with your doctor. And then of course, you know yourself, how much physical activity you're getting, where's your weight, what's your diet look like, do you have diabetes? all of these are risk factors that everyone should be considering thoughtfully when looking at ideal cardiovascular health. So one thing and that the AHA has proudly coined and shared far and wide for many, many years is what we call Life's Simple 7. And Life Simple 7 is just making little changes every single day that can add up to big improvements in your overall health. And so Life Simple 7 outlines a few easy steps that everyone can take. Sometimes it's even just a matter of changing 2 or 3 of these things and seeing how that could alone impact your overall health. Sometimes all 7 could be overwhelming. So starting slow and starting simple and looking at some quick minor changes you can tweak every day to impact your health. So I'm going to dive into all 7 of those with this group. First being the importance of managing blood pressure. Why is this so important? Well, it's the single most significant risk factor for heart disease, and it's very common. So 1 out of 3 American adults have high blood pressure, but what's scary is that many of them are not aware of it. We at the AHA often call it the silent killer because it doesn't often present with symptoms. And so most folks feel fine, and if they aren't routinely going to see a physician or self-monitoring their blood pressure on their own, they may never know what their numbers are. So to take action, always know your numbers. Consult with your doctor, get a blood pressure cuff at your home, make sure you're checking that regularly, and then managing it according to your physician's care plan. Some ways to also help manage blood pressure is to eat a heart-healthy diet and really reduce your sodium intake, and then also learning healthy habits for eating well and staying active. Looking at the next simple lifestyle change is getting active. So daily physical activity increases your length and quality of life, and it really helps keep your heart in really good condition. And so oftentimes we tell people just start by walking. Not only is that good physically, it's also really good for your mental health, to take a step away from the desk, the office, wherever you might be plugging in most of your time during the day, and just walk for 30 minutes. We encourage that, at least 30 minutes a day, at least 5 times a week. We often share with workforces that we encourage walking meetings instead of, maybe sitting in a boardroom all day. Could some of your meetings be, walking around your campus, walking around your office, things to just get you moving and out of your chair. And then also choosing activities that you can enjoy. Getting active doesn't mean running 45 minutes on a treadmill every day. It could mean dancing, it could mean swimming, it could mean bike riding, gardening, all the things that you enjoy. Look at them as ways that could help you get active throughout the day. And then controlling your cholesterol. So this is very important because when there's too much cholesterol in your blood, you're at major risk for heart disease and stroke. And so we very much encourage that you follow your healthcare provider's advice when it comes to controlling your cholesterol. A lot of that will stem from what you're feeding yourself and what your diet looks like. So being very conscious of making healthy food choices that are low in cholesterol, but also that are low in trans fats and saturated fats. And then again, get your body moving, get active, maintain a healthy weight. And then eating better, which I think all of us know, all of us here, but a healthy diet is one of our best weapons for fighting cardiovascular disease and staying healthy. At the AHA, we have things that we like to say yes to and things that we encourage people to say no to. So in terms of saying yes, say yes to lots of fruits and vegetables. Your plate should be colorful and vibrant. Look at whole grain carbohydrates. Look at fat-free and low-fat dairy products. And then also, if you are a fan of fish or seafood, pull some of that into your diet. They're so rich in omega-3 fatty acids, which are great for your cardiovascular health. And then really saying no to or just being extra cautious or conscious about foods and especially beverages that are very high in sodium or include a lot of added sugar. And the reason I highlighted beverages is because many of them, many sodas, drinks, contain more than you would think if you were just eating a cookie or a dessert. So being conscious of what types of beverages you're putting in your body as well. And then losing weight, which can mean different things. You know, this slide talks a lot about BMI, but I think nowadays we know more about, you know, the BMI may not tell you everything. So looking at, you know, your all in weight, but looking at, you know, what's your fat content versus, you know, your bone density and your water weight, and factoring all those things and ensuring that you're looking at, you know, a healthy weight in terms of all of those numbers. If a person has too much fat on their body, they are at higher risk for high blood pressure, high cholesterol, and diabetes. And so, you know, really taking that into consideration when you are weighing yourself or when you're at your physician's office, ensuring that you're looking at that whole picture on the scale. A simple way for someone looking, or I shouldn't say simple, but when you break it down simply to lose weight is kind of balancing calories in versus calories out, but always being conscious that you are feeding your body the healthy nutrients you need. But looking at, you know, reducing your calories in by planning your food choices and sticking with your plan. And then to balance with those cardios or those calories out, how are you, you know, increasing your physical activity every day? Maybe it's 30 to 45 minutes per day, to ensure that you're getting that balance, which will help shed some of those pounds, and then hopefully help lower your fat content too. And then of course, stop smoking. Smoking is the #1 modifiable cause of death. And it's definitely a serious topic right now as we're looking at children who are picking up vapes and e-cigarettes and have no idea what really is in there harming them. This is so critical that we're spreading the education about how something that you could, you know, never choose to do could really increase so much harm. And so certainly talk with your healthcare provider about this. We at the AHA have a lot of resources when it comes to quitting smoking, whether those are local resources or just things that you can read online. We want to support you through that journey, knowing it can make such a big difference for your heart health. We also encourage, you know, folks who are on the journey to quit smoking, focus on the rewards. You know, what's going to come from that? How is that going to not only benefit your health, but the people around you as well? And then also being conscious of any roadblocks that might come your way and just kind of mapping those out in advance so that you're equipped with, you know, the right tactics, the right solutions, so that you don't revert back to that old habit you're working so hard to quit. And then last, but certainly not least, is looking at reducing your blood sugar. And so high blood sugar encourages the growth of plaque in your arteries, which of course really increases your risk for diabetes, heart disease, and stroke. And so, you know, we encourage to reduce the consumption of simple sugars that are often found in your favorite sodas, candy, and unfortunately your favorite sugary desserts. And just, you know, plan your meals, plan your treats out smartly, so that you're aware of how much of that you're putting in your body. You know, everything in, you know, a balance and, you know, everything minimized. You can always indulge a little bit, but be conscious of how much you're doing that. And then also, as I've said on almost every slide, regular physical activity helps with monitoring and reducing your blood sugar too, because it helps you maintain that healthy weight. So that is Life's Simple 7. Again, just to reiterate some of these tools, some of you might be doing really well, which more power to you. But I hope today, maybe there's a couple of you who felt, hey, there's just 1 or 2 of those that maybe I could take a harder look at and be a little bit better each day or 4 days a week. And that's what it really is about. Simple tools that you can build in each day and start small, to help, you know, your overall heart health. Also, I just wanted to share that the AHA has a wealth of information on our website, but we also, our local chapter is very engaged in our community. We work within all of the various corporations here, and community impact projects. And we love to engage people in our mission. And so if you are someone here today who's interested in learning more or getting more involved with us, I always like to start by sharing our core campaigns and events, which are really landmarks throughout the year in our community where we celebrate our work. And so just to quickly share, we have our Go Red for Women luncheon. That campaign celebrates women's heart health and really spreads awareness around women and how important it is to know their own risk factors and to also advocate for more research around women and heart health, because it's been dominated by research about men. And we know men and women are different, our bodies are different. And then the Heart Walk, which really promotes workforce health and active lifestyle. That we celebrate that every year, where we gather in the community. We have a 5K, we have a walk. And it's a great way to get families and workforces together through some team fundraising and also just to, promote an active Saturday on your feet. And then the Heart of Indianapolis campaign, which I'm very passionate about because it's the one I help lead, is about our Heart and Stroke Ball, which is our annual gala where we, gather leaders from businesses throughout the community to come join us for an evening of elegance, but also celebration of our mission throughout the year and all that we've accomplished. And then lastly, but certainly not least, we have an initiative here locally called Hard Hats with Heart, which is our first industry-specific event where we're looking at the heart health of those in the construction industry. And so we have a networking event and campaign around looking at them. Most of them are higher risk for heart disease. So how can we share our resources and education around ensuring that they're living heart-healthy lifestyles as well. So that's it in a nutshell. I know that Jordyn and Sarah and I will remain on for any questions, but just wanted to thank you for tuning in today and learning a little bit more about how you can be sure to have a heart-healthy diet.
Thank you so much, Haley. And like Haley said, we're here to answer all questions. You'll see on the right of your box, there's a spot that if you guys do have any questions, feel free to reach out. But we are so grateful that community partners exist like the American Heart Association. And Haley, thank you for taking the time to educate all of us on all the programs out there and how to live healthier lives. If you guys are one of our clients and you guys know that your company has taken advantage of Go Red and has done some really cool Heart Health Month events, we'd love to see that on social media. Feel free to tag Apex Benefits and we'll give you guys a shout out for living a healthy lifestyle. It's something that I know even Amber Chittenden, our VP of client engagement, is very involved on this mission, and we're grateful that she has been able to share Haley and all the resources that exist. So general housekeeping while I'm looking at some questions here. Apex's reminder is going to bring to you on the 4th Tuesday of every month a 30-minute webinar that's going to go through a different topics each month. The next one is March 22nd, and it's Food and Mood. It's one of our favorites that's all about our moods dictating what we're actually eating. So come to that on March 22nd. You'll see a link in the next webinar or in the next newsletter that goes out to everybody. We'd love for you guys to continue joining. And then if anything rang a bell about Life Simple 7 that Haley spoke to, that you guys would like some extra guidance on, feel free to reach out to your Kinetiq Health representative, and we would love to meet one-on-one to have discussions on how we can all improve our lives. So I'm not seeing any direct questions here right now, but if you guys do have any follow-up questions, all of our email addresses are right here on the screen. So we hope you took something away from the past 30 minutes, and if you have any questions, feel free to reach out. Thanks again, Haley.
Thank you. Thanks, everyone. Happy Heart Month.